Good morning, sir. I'm Princess Dayan Almudal. For today's video, we will be doing the demonstration on how to do the suctioning. It's a medical aspiration of pulmonary secretion from client with an artificial airway. In place, it is the process of removing the mucus and the fluids from the nose, mouth, or back of the throat valve. The valve syringe or catheter. Suctioning clear mucus from the tracheostomy tube and is essential the proper breathing. The purpose of this is to seek out the secretion, then the procedure may differ depending on the client. If newborn or infant, start on the mouth and proceed to the nose, because if you will start on the nose, you will trigger the sneezing reflex and this will result into aspiration. And for the adult suction, the mouth first, then proceed. This is done for the aesthetic reason. So here are all the equipments that we are going to use. We have the suctioning machine, we have the tubing, the catheter, the oximeter, the sterile water, the lubricant, and the sterile gloves, and also we have the clean towel.
Now we're going to form the proper hand hygiene by washing our hands with clean water and soap. Washing our hands control the spread of microorganisms and the infection. And then we're going to rinse with clean water.
So for the procedure, we have to assess the client condition, if there is a bleeding disorder, epiglottitis, or laryngospasm. So how to check the client? Hi ma'am, my name is Princess, your caregiver for today. We will be doing the suctioning procedure. Would that be okay with you, ma'am?
Yes,
May I know your name, ma'am?
Melody.
And your birthday, ma'am?
December 24.
Okay, thank you. For the procedure, we have to assess the client condition, if there's a bleeding disorder, epiglottitis, laryngospasm. So how to check the client? Place the oximeter on client's finger and leave the device in place. So this is the oximeter. Then we're going to place it on the client's finger. And now, we're going to reposition the client into semi-polar's position. Ma'am, I'm going to position you into semi-polar position. Prepare your equipment by connecting one end tubing suction. So this is the tubing suction. Now we're going to turn on the device and then we're going to set the device into the lowest level. Into the lowest level. And then we're going to check the pressure by blocking the suction. And now we will prepare the suction catheter. So this is the suction catheter. And then we were going to place the drape or rubber pad Now we're going to fill the tray with 100 ml of sterile water. And then we're going to open the lubricant. Apply the sterile gloves on the dominant hand, which is the right hand, and the clean gloves on the other hand. Use the dominant hand or the right hand to pick up the suction catheter. And then, we're going to put small amount of saline from the basin. Then lightly coat 6 to 8 centimeter or 0.4 to 32 inches from distal end with water-soluble lubricant. And then explain that your suction from nose down to lung and help get out from those secretion using your non-dominant hand and remove the oxygen mask. Now we're going to put lubricant. Then raise the client prescribed flow rate and instruct her to breathe slowly. Inhale, ma'am. Exhale. Now, using the non-dominant hand, remove the oxygen mask. Ask the client to inhale deeply. Use the dominant hand and forefinger to insert the catheter gently but quickly as she inhales. Okay, ma'am? Inhale, ma'am. Okay. Do not cover the catheter vent and then orient the catheter downward safely. Don't force it. If you feel resistant, you probably hit the carina in that case. So withdraw the catheter 1 to 2 cm before applying the suction. When performing nasopharyngeal suctioning, a good general rule is to insert the catheter into the same gap as the distance from the tip to the nose down to the mandible. In adult, is about 6.4 inches or 16 centimeter, and an older child is 3.5 centimeter, and for infant, 1.6 centimeters. Slowly withdraw the catheter as you roll it back. Back and encourage the client to come. Ma'am, can you ko? Again, ma'am. One more. Thank you. Alright, and then we're going to replace the oxygen device. And now we're going to replace the oxygen device. Are you feeling good, ma'am?
Yes.
Ma'am, can you inhale properly? Then you can perform not more than 2 passes, then watch for alteration in the client's cardio, pulmonary status by checking it with your stethoscope. Arm, inhale. Exhale. Allow at least 1 minute suction time before performing another pass to allow for ventilation and oxygenation, and then raise the catheter and connecting tubing by suctioning the normal saline until the catheter has been clear, and then detach the catheter from connecting tubing. And now we're going to detach the catheter from connecting tubing. Until the catheter has been clear, and detach the catheter from connecting tubing, the loop around the finger and pull the gloves. Now we're going to pull the gloves inside out to isolate the contaminants. Then remove the other gloves. And then remove the other gloves and turn off the suction device. Now we're going to remove the drape. And then reposition the client. Perform hand hygiene, the procedure including your further and post-suctioning, the amount, the consistency, the color, the odor of the secretion of the client, the size of the catheter used in the patient's response. This is a very important in nasopharyngeal suctioning. If the patient is conscious, next should be hyperextended collar's position depth from the tip of the nose to the tip of the earlobe. Duration should not be more than 10 to 15 seconds. Every interval is 20 to 30 seconds. It should be done with 5 minutes. And if the patient is unconscious, flat in bed with head to the nearest lateral position. Depth from the tip of the nose to the earlobe. The duration should not more than 10 to 15 seconds. So every interval is 20 to 30 seconds. It should be done with 5 minutes.